In this session, let's have a demonstration of the structures seen in superior mediastinum. As you know, the superior mediastinum is bounded anteriorly by the body of manubrium sternum. Okay, the manubrium sternum, the lower limit of the manubrium sternum corresponds to the lower border of T4 vertebra. Okay, so this imaginary line passing through the angle of Lewis or the lower border of manubrium sternum forms the lower limit of superior mediastinum. So the superior mediastinum structures lie behind the manubrium sternum. So what are the structures that are seen behind the manubrium sternum? The structures seen here can be seen from anterior to posterior. What are the anterior-most structures, or otherwise the more retrosternal structures? The structure that is immediately retrosternal, but that is not seen here in this dissection, is the thymus gland. Okay, the thymus gland might be seen in some individuals or in most of the children. Okay, so except for the thymus gland, the other structures that we see here are immediately next to the thymus gland. You will see the vein. Which vein? So what is this vein that runs transversely from left side to the right side? So this is your left brachiocephalic vein. This travels from the left, it goes to the right downwards, and it joins with the right brachiocephalic vein to form the superior vena cava. So the upper part of superior vena cava, then the right brachiocephalic vein and the left brachiocephalic vein are seen in the anterior most as seen as the anterior most structures in the superior mediastinum. You also could appreciate that the left brachiocephalic vein receives its tributary, the superior left-sided superior intercostal vein. The superior intercostal vein is actually formed by fusion of the second, third, and fourth posterior intercostal veins. Okay, on the right side, the superior intercostal vein drains into the arch of azygos. On the left side, the superior intercostal vein drains into the brachiocephalic vein. Next to the brachiocephalic vein, we could appreciate the arch of aorta. This is the arch of aorta. The arch of aorta is seen along its origin, and the termination falls within the superior mediastinum. And you could see the three major branches of arch of aorta, that is, from right to left you have the right brachiocephalic trunk, then the right left common carotid, and then the left subclavian trunk. Okay, so brachiocephalic trunk, which divides into the subclavian and common carotid, and then you have the left common carotid, and then the left subclavian trunk. These three are the branches of arch of aorta. The arch of aorta arises at the level of lower border of T4 or lower border of manubrium sternum. Okay, and ends at the same level. Okay, and its three major branches are seen in the superior mediastinum. So in front we have the vein, then you have the artery. Okay, and along with this artery you could see the artery, arch of aorta and its branches. Along with its branches you could see this nerve. What is this nerve? This nerve is the one which is accompanied, which is seen in the groove between the carotid artery and the internal jugular vein in the carotid sheath. What is that nerve? Yes, that is the vagus nerve. The vagus nerve is seen to come in relation to the branches of the carotid artery, arch of aorta, in the superior mediastinum. And on left side, the left vagus nerve, it comes to the lower limit of arch of aorta. Okay, here it gives off this recurrent branch. This is called the recurrent laryngeal nerve. This recurrent laryngeal nerve loops around the arch of aorta at the level of ligamentum arteriosum. Okay, to travel, to have a recurrent course above. Okay, whereas the right vagus nerve is seen behind the superior vena cava. Okay, the right vagus nerve is seen behind the superior vena cava here. Okay, so this is the right vagus nerve. The right vagus gives of the recurrent laryngeal nerve higher up, which will wind around the subclavian tract. Okay, fine. Okay, along with the superior vena cava, you will happen to see the phrenic nerve. This is the right phrenic nerve. Okay, on the left side you will have the left phrenic nerve. Okay, so if you go from right to left, what are the structures which are seen behind the sternum? You have the phrenic nerve, then the superior vena cava under the right brachiocephalic trunk, then the left brachiocephalic trunk, then you will have the arch of aorta, and then the brachiocephalic trunk for the right side artery, brachiocephalic artery for the right side, then the branches of other two branches of the arch of aorta, then you will get the left vagus nerve, then left phrenic nerve. Okay, fine. So and then here you will have the brachiocephalic vein, left brachiocephalic vein receiving the superior intercostal vein. Okay, so anterior to posterior, and then from right to left, these are the structures seen more anteriorly in the superior mediastinum. Behind the arteries, what other structures are there? Behind this branches of the arch of aorta, we have the trachea and esophagus. Two tubes are seen. Okay, fine. So like behind this, so I cannot show them, you just have to imagine. Behind this branches of the arteries, you have the trachea and esophagus. On the left side of the esophagus, you will have the thoracic duct. Okay, once you could retract or reflect these structures of the mediastinum in the superior mediastinum, you can see the posterior mediastinum structures. Okay, in the groove between the trachea and esophagus, you will have the recurrent laryngeal nerve. The recurrent laryngeal nerve on the left side and on the right side, they will be traveling in the groove between the trachea and the esophagus. In the groove between trachea and esophagus, you will have the recurrent laryngeal nerve on the right side and on the left side. Okay, fine. So once again, the boundaries of the superior mediastinum are anteriorly the manubrium. Okay, anteriorly the manubrium sternum. Okay, posteriorly the bodies of the first four thoracic vertebra, and in the sides you have the mediastinal pleura. Above you have the thoracic inlet, and in the below you have the sternal angle. An imaginary line that passes through the sternal angle that will go along the lower border of T4 vertebra. Thank you.